Hello, welcome to Med School. This is our ECG Q&A series and this is question number 5. So the question is, a 45 years old male patient presented to casualty early morning at 5 am with central chest pain that has been started after 10 minutes of exercise. The chest pain subside after 15 minutes, but at T25 plus, patients complaining of chest tightness. So what does his serial ECG shows and what would you do? These are the ECGs which were taken time to time. So let's start with the first ECG. In the first ECG, there is an evolving anterolateral ST elevation MI. Okay. See, there is an ST elevation in V2 to V5 and AVL lead, and there is reciprocal ST depression in third lead, AVF lead. There is a pathological Q wave in V2 and V3, and there is also hyperacute T wave in V2, V3 and V4 and first lead. Okay, this is all about the first ECG. Now come to the second ECG. In second ECG, there is a transient improvement in the ST changes with development of biphasic T wave in V2 and V3. So what's the important point here is the pattern of T wave changes in V2, V3, which is also known as Wellens syndrome. So what actually Wellens syndrome indicates is, it indicates reperfusion of the previously occluded left anterior descending artery. Okay, so the implication of this ECG pattern is that there is an underlying critical left anterior descending artery stenosis that requires emergent reperfusion, ideally via percutaneous coronary intervention, means PCI. Now come to the third ECG. In third ECG, the previously biphasic T waves are now upright again. So this phenomena which we are noticed here is referred as a pseudo normalisation and is a marker of reocclusion of affected artery. Now let's come to the last ECG. The ECG demonstrates a anterolateral ST elevation MI with evolving ST changes. So what happened is, this patient has taken immediately to the cath lab where he was found to have a 100% proximal left anterior descending artery occlusion. He was stunted, successfully cardioverted and made a good neurological recovery. So the golden point here is there are two different patterns of T wave abnormality seen in Wellens syndrome. Type A is biphasic with initial positivity and terminal negativity, which is seen in 25% of cases. And type B is deeply and symmetrically inverted T wave, which we seen in most of cases, means 75% of cases. These changes evolve with time after reperfusion. And the last important point is pseudo normalisation. Pseudo normalisation of a T wave may be the first sign of occlusion myocardial infarction, means OMI, in patient with Wellens syndrome. Thank you.